The CDC defines chronic disease as a condition that lasts 1 year or more and requires ongoing medical attention or limits activities of daily living, or both. So the term chronic disease refers to many different health conditions. These include heart disease, diabetes, depression, arthritis, high blood pressure, osteoporosis, and dementia. It's also estimated that about 60% of adults in the US are living with at least one chronic condition, and 40% of adults have 2 or more. In addition, about 25% of children between the ages of 2 and 8 have a chronic health condition. The prevalence of these conditions means that you will have clients living with chronic health issues. While it's not your job to diagnose or treat these conditions, you can work with the client and, if necessary, their healthcare providers to get them moving with an exercise program. After all, a healthy lifestyle with healthy eating patterns, exercise, and stress management has been found to reduce the physical effects of many chronic conditions. They may even be prevented if lifestyle modifications are made early enough. With medical clearance, clients with conditions like hypertension or heart disease can train with you. You'll just need to be aware of considerations that will affect the way these clients exercise. For example, a client with heart disease may only be able to get their heart rate up to a certain level, especially if they're taking medications to control their condition. For clients with high blood pressure, activities that require them to go from a lying to a standing position quickly are not advised either, since they can dramatically affect blood pressure. A client living with diabetes may need to ensure they eat before their training sessions to prevent drops in their blood sugar. They may also need to check their blood sugar before, during, and after a training session to make sure they're within a normal blood glucose range. In many cases, these clients will know their limitations and come prepared. All you have to be is aware and prepared.
The hip hinge is a fundamental human movement pattern. However, it's known for being a notoriously difficult movement to teach. The only joint that is supposed to move is the hip joint, but oftentimes other joints get involved. Ideally, the hip hinge begins upright with the feet firmly on the ground. The movement is initiated by bending at the hips and pressing the hips backward. A line should be able to be drawn from the hips through the spine and top of the head. This line needs to be maintained as you go further into the hinge. The further you hinge, the more your hips should also move toward the back. A great drill to promote the backward movement of the hips is the hips to wall drill. Start by standing with your back approximately 6 to 12 inches from a wall. Keeping the spine in alignment, bend at the hips and press your backside towards the wall. Continue this movement until you can tap the wall with your glutes. Reverse the motion back to the starting position. Step forward about an inch at a time and repeat until you can no longer reach the wall. The most common mistakes when performing a hip hinge occur at the head, shoulders, and spine. You may observe rounding of the back and shoulders and extension of the neck. In addition, clients often make the mistake of starting the movement with their head and shoulders rather than the hips. This leads to rounding of the shoulders and eventually the back. A great tool to use to improve the hinge is a simple dowel rod. Have your client hold the dowel behind them in line with their spine. One hand will hold the rod in the curve of the neck, while the other hand will hold it in the curve of the low back. The rod should make contact with the back of their head, the mid-back, and the tailbone. They'll continue hinging while maintaining these 3 points of contact. Practicing this movement will ensure good mechanics and prepare a client for a variety of important exercises. Deadlifts and kettlebell swings are just a couple of examples that require proper hip hinging to perform properly.
So you've done your static and dynamic assessments. Now what? You'll need to take your observations and turn it into a program to improve movement dysfunction. Don't be overwhelmed with all that you've observed. It's actually simpler than you think. If you understand the basic musculature of the body, you're off to a great start. I personally am a corrective exercise specialist, so I love the challenge of identifying movement dysfunctions. Every personal trainer has to have a baseline knowledge of this discipline to be effective with assessments and programming. But if you're as interested as I am in this piece of fitness, definitely consider getting certified in corrective exercise. You'll gain a lot more insight into this process and be better equipped to help clients move better. Now back to assessment results. When the body compensates during movement, some muscles are short. They're tight or what we would call overactive. Identify these muscles first. Once you identify the overactive muscles, use your knowledge of muscle antagonists and identify their opposing muscles. These are most likely the underactive or inhibited muscles you'll want to address. Muscles you found to be overactive or shortened need to be stretched and inhibited. You'll program this with flexibility training, foam rolling, and myofascial release techniques. Muscles you found to be underactive or lengthened need to be activated and strengthened. Understand that this can't happen until you've stretched and released their antagonists first. Then you can program activation exercises and strengthening exercises to even out the muscular relationships. Consistency is key with your corrective programming. One session of foam rolling, stretching, and activation is not enough. Incorporate the appropriate corrective methods into every workout as a part of your warm-up to ensure you're adequately addressing the issues. When you retest the assessments, you should see improvements and you'll
Myofascial release techniques are used by many fitness professionals to help clients recover from exercise and move better. However, you should understand the best ways to utilize this technique to maximize mobility and results. Clients and trainers sometimes think foam rolling is done after a workout. Although it might feel good and has its benefits, the real value comes from foam rolling before working out. The technique can increase muscle pliability, reduce excessive muscle tension, and increase joint range of motion. This can help make a workout more effective and reduce the risk of injury. The goal of self-myofascial release is to help an overactive muscle relax. So for the best results, a 30 to 45 second hold on each tender area is recommended. You won't actually roll on the area. It takes this long to trigger the relaxation reflex and reduce muscle tension. You'll also need to coach clients to relax as much as possible when performing myofascial release. It's not the most comfortable thing to do, so a lot of us tense up when we hit a tender spot. Coach clients to breathe deeply and do their best to reduce voluntary muscle tension throughout their body for the best results. Foam rolling takes a decent amount of time when it's done properly. For example, it could take 15 to 20 minutes to roll one of your quadriceps if you work the angles of this broad muscle group. With that in mind, it'll be important to teach each client how to foam roll on their own so you don't have to waste precious time during a training session. This is part of the teaching that you'll do with your clients to give them the highly motivational autonomy that most people want. You'll show them how to take care of themselves, even when you're not there.
Muscular contraction moves the skeleton and creates human movement. It's really that simple. But let's talk more about the length-tension relationship. This means you'll need to think about the parts of the muscle that we can't see. Inside of the muscle fiber within the myofibril. In simple terms, the concept of length-tension relationship explains the amount of force a muscle can produce is directly related to its length, or more specifically, the length of the sarcomeres. The sarcomeres are the repeating functional units within a muscle. They're made up of thick and thin filaments called myosin and actin. The muscle is able to contract when these thick and thin filaments slide past each other after an electrical nervous impulse triggers the release of calcium into the myofibril. ATP and ADP are the energy source for the formation of the actin and myosin cross bridges as the sarcomere shortens. As the sarcomere shortens, so does the muscle itself. The myosin and actin cross bridges that cause the sarcomere to shorten can only occur when the thick and thin filaments overlap. So, this means that the length of the sarcomere has an effect on how much tension the muscle can produce. The ideal sarcomere length to produce maximal contraction is between 80% and 120% of the natural resting length. Within this range, the maximum amount of cross bridges between the thin filaments actin and the thick filaments myosin can be formed. When a muscle is overly shortened, there's also a large amount of thick and thin filament overlap. However, muscular tension is negatively affected since the sarcomere is limited in how much it can continue to shorten when the filaments bump into the ends of the sarcomere. This area is called the Z-disc. When the muscle is excessively lengthened, there is minimal overlap of the myosin and actin, where very few cross bridges can be formed. In this case, less tension can be produced. Taking it a step further, a muscle can be lengthened to the point where there is no overlap in the thick and thin filaments. This means no tension can be produced at all. If you think about how to apply this as a personal trainer, consider the applications of stretching and how tight muscles can affect how our muscles contract. When someone performs static stretching before a training session, are they shortening or lengthening their muscles? If you said lengthening, you're right. Static stretching lengthens the muscle. This means that there's going to be less overlap of the actin and myosin filaments within the sarcomere. And do you remember how this will affect its ability to generate force? It reduces the muscle's ability to generate force, which is not ideal right before an exercise session, right? Now think about a tight muscle. If it's tight, is it lengthened or shortened? If you said shortened, you're also right. Recall that a shortened sarcomere and muscle also cannot generate as much force even though there's plenty of thick and thin filament overlap. This means that flexibility techniques like dynamic stretching, static stretching, and myofascial release can be used to reduce muscle tension and return the sarcomere back to the ideal length for maximum muscle tension. Keep in mind, the flexibility technique you have a client use will be based on when they apply the technique. Dynamic stretching and myofascial release are ideal for before and after a training session, while static stretching, as we've learned, is best done after training or on a rest day.
As a trainer, it's inevitable that you will get questions about whether your clients should use ice or heat. The short answer is the most common answer in fitness. It depends. It'll be helpful for you to have basic knowledge of each strategy and how they affect the body. When you apply ice, the receptors in the skin sense things like pressure and temperature. And our skin has more cold receptors than heat receptors. When the skin senses a cold temperature, it activates the cold receptors and blocks some of the sensation of pain. Icing also causes vasoconstriction, or the narrowing of blood vessels. This reduces blood flow and helps to slow the body's inflammatory response that may accompany an injury like swelling or redness. Ice can also be helpful for relieving and preventing muscle soreness after exercise and may help shorten recovery time. Icing, however, is not always the best solution. Heat is often used as a therapy to help relieve pain and promote healing. When you heat an injury, the warmth causes vasodilation, or the widening of blood vessels. This increases blood flow to the injured tissue, which in turn increases the amount of oxygen to speed healing. Both heat and ice have their place in training and recovery. When you understand how each one affects the body's tissues, it can help you make the right therapeutic choice for yourself and for your training clients. Just always remember, you cannot diagnose or treat injuries. Clients with injuries or pain should be referred to their physician.